Hello.
Yes, we can hear. We can see.
Yeah, yeah. Okay, great. Okay, so jumping into the question. So the first question reads, which one of the following is incorrect about biofilms on implant surfaces? It prevents antibody penetration to the bacterial surface. It sequesters bacteria-specific ions and nutrients. It increases antibiotic interaction. It enhances virulence of the bacteria. It prevents macrophage bacterial interactions. So, which of the following statements would be incorrect about biofilms? What do you guys understand about biofilms? Is it a host response, meaning humans are producing these biofilms, or is it a pathogenic response, or is it the biomaterial itself that's producing these biofilms? Who is producing these biofilms?
Biometal itself, sir.
Okay, so usually these biofilms are produced by the pathogenic bacteria. The bacteria are what produce these biofilms in response to environmental stresses, be it antibiotic treatment, nutrient deprivation, immune stress, so on and so forth. So there can be so many different reasons why bacteria can produce these biofilms. And this is a big problem for implants and such because the implants, the very interface of implant in the body attracts a lot of immune cells, and if you have antibiotics in your implant, they'll slowly be released at the interface of implant and the body, and bacteria which can produce biofilms. Like, does anyone know what the most common biofilm producing pathogenic bacteria is in humans when it comes to implants? There are a couple, but have you guys heard about Pseudomonas aeruginosa and Staphylococcus aureus? So Pseudomonas aeruginosa is one of the bacteria that has this great potency to produce biofilms. So, and it's a major clinical problem. So, a lot of patients with these implants, they come with Pseudomonas aeruginosa infections. They would usually have these biofilms. So now the question is, which of the following statements is incorrect about these biofilms? Do they prevent antibody penetration, or they sequester bacteria-specific ions and nutrients, or do they increase antibiotic interaction, or do they enhance virulence of the bacteria, or do they prevent macrophage bacteria interactions?
Mm, The following is incorrect about
So the way to think about it is biofilm is being produced by the bacteria, and the bacteria produces biofilm in an attempt to survive harsh environmental conditions, right? Be it antibiotics or immune system. So if a bacteria is producing this biofilm to survive antibiotic rich environment, would it increase the antibiotic interaction or decrease the antibiotic interaction?
decrease the antibiotic interaction.
Correct. So then the incorrect
Answer.
option would,
That's third. Okay.
yeah.
It
So
increased.
the incorrect option would be it increases antibiotic interaction. So biofilm is nothing but a very rich extracellular matrix along with some slimy substance that the bacteria can produce. Okay. Yeah. So it in fact decreases antibiotic interaction. In fact, it prevents antibiotic as well as antibody penetration and interaction with the bacteria. Okay, moving on. So, why are stents used in blood vessels for tissue engineering? Two options are correct here: to heal blood vessels, to prevent hemorrhage, to open occlusions from blood vessels, to bypass a blocked artery or vein, to help grow a new blood vessel in its vicinity, to prevent senescence, to cause further damage to excessive blood vessels, or to increase diameter of blocked blood vessel, hence increasing fluid flow. Why is
Last option, sir. To increase diameter.
okay? What could be the other option?
Third one, sir. To open oxidation from cells.
Okay. Yeah, so basically, stents are used in case of occluded vessels, right? So, if you remember seeing a stent, so it's basically a surgical instrument that's pushed through the vessel, and there's a balloon which sort of blows up and enlarges this vessel. There is a mechanism to clear the occlusion, something like a vacuum pump, and the stent ultimately is the metallic or polymeric device which will hold the blood vessel in its increased diameter state. Okay. Which of the following methods would you use to prevent bacterial adherence on a device? Pick two options. Would you have a rough surface, a regular smooth surface, a hydrophilic surface, or a hydrophobic surface? How
The
would
following
how would you prevent bacterial adherence on a device?
regular smooth surface
Correct.
and
So would you want a hydrophilic surface or a hydrophobic surface? So when you're thinking about whether you want a hydrophilic surface or a hydrophobic surface, think about what interacts with the device, right? So in this case, what part of bacteria would interact with the device? It would be the cell wall. What is
yes,
this cell wall made up of?
cell
Lipids
wall
and
and
proteins.
polysaccharides and
Po-
lipids.
Polysaccharides, lipids, proteins, right? So
Yes,
And the lipids may be it is consist of head and tail and it is hydrophilic and hydrophobic.
correct, correct. So if you look at the orientation of the lipids, okay, so in that case, what would the bacteria ideally prefer? Would it prefer a hydrophilic surface or a hydrophobic surface? If it's made up of
hydro,
this,
hydrophobic.
correct. So
Answer is hydrophilic.
yeah, so it would prefer a hydrophobic surface, but if you want to prevent the bacterial adherence, you would want a hydrophilic surface then. So because the bacteria likes hydrophobic surface, you want a hydrophilic surface, and if you have a rough surface, the surface area is increasing a lot, and it can provide niches for the bacteria to grow. So then you would want a regular smooth surface. Okay. Which implant device has highest rate of infection? Pick one option. Dental implants, vascular grafts, mammary implants, penile implants, heart assist devices, fracture fixation devices.
Heart
Which,
assist device.
okay. Any other thoughts?
So heart assist devices.
Okay. Okay, yeah. So heart assist devices are usually the ones with highest rate of infection because they are not very easily accessible for you to maintain hygiene like the dental implants. And usually you do not want any drugs also associated with them releasing very close to the heart, and a lot of blood goes to the heart, right? So that's where you would have the highest rate of infection. Okay. So, what are the common approaches used to reduce implant associated infections? Sterilization, gene bombardment, surface modification, coating with a metallic paint, annealing, heat working, and pulling into sheets. So, what are the common approaches used to reduce implant associated infections? Two options are correct here.
Sterilization
Yeah.
and surface modifications.
Okay. Yeah. So you can sterilize your implant, and you can also surface modify it with maybe peg to prevent bacterial adherence. So those are the two approaches that are commonly used to reduce implant associated infections. Okay. Moving on, which one of the following is not a feature of implant infection? Adhesive bacterial colonization on the material, resistance to host defense mechanisms and antibiotics, Transformation of non-pathogenic or opportunistic to virulent organisms because of presence of biomaterial substratum, persistence of infection until removal of material, absent absence of tissue integration, tissue healing, or presence of tissue cell damage and necrosis. Which of the following is not a feature of implant infection? What does not happen during implant infection?
Tissue healings.
Yeah, tissue healing does not happen during implant infection, whereas all the other things can happen. So, transformation of non-pathogenic or opportunistic to virulent organisms. I've given you example previously, Pseudomonas aeruginosa, which is usually opportunistic, but once host immune system deteriorates or the opportunity presents itself, such as a biomaterial substratum, it can transform into a pathogenic bacteria and so on and so forth. Okay. How biofilms inhibit host defense mechanisms? Pick the false statement. Preventing antibody penetration to the biomaterial surface, reducing virulence of the bacteria in biofilms and making them susceptible to immune effectors, preventing macrophage bacteria interactions, reducing polymorphonuclear leukocytes, chemotaxis, or enhancing virulence of the bacteria, or preventing antibiotic interaction. How do these biofilms inhibit host defense mechanisms? So we're talking about host defense mechanisms here. So preventing antibiotic interactions does not really play a role. So does it enhance virulence of the bacteria, a biofilm? So yes, so biofilms are found to increase the virulence of bacteria. So they make the bacteria become more virulent. So that's not going to inhibit your host defense mechanism. Uh, Reducing polymorphonuclear leukocyte chemotaxis, preventing macrophage bacterial interactions, reducing virulence of the bacteria in biofilms, or preventing antibody penetration to the bacterial surface. So those are the options we have left. Uh, yeah.
Second one, reducing virulence of.
Okay. So if a biofilm is reducing the virulence of bacteria and making them susceptible to immune effectors, it's not really inhibiting host defense mechanism, right? It's helping the host defense mechanism. And in fact, biofilms are found to enhance the virulence of bacteria. So that might not be the correct option. So what else could be the correct option? What How are biofilms preventing your immune system from killing the bacteria or removing the bacteria? Oh, sorry. So they're asking us to pick the false statement. So
False
you're
statement. That's why, yes.
Yeah, you're correct. So reducing virulence of bacteria in biofilms and making them susceptible to immune effectors is in fact false. So they do not do that, and even if they do that, it's enhancing your host defense mechanism. Yeah, you're correct. Okay. Which of the following is an advantage of decellularized matrix? Two options are correct here. Toxicity of detergents used is an advantage. Fragments of ECM triggers clotting cascade. The matrix does not trigger immune response. The network of natural ECM is suitable for growing cells. Difficult to produce on large scale. So, which of the following is an advantage of a decellularized matrix? So, what is a decellularized matrix? You basically take a tissue from either the host himself or somewhere else, and you remove all the cells and you preserve the cytoskeleton, right? So that's what a decellularized matrix is. Now, what be the advantage? Does it not trigger immune response, or Does it trigger clotting cascade, or is it the toxicity of the detergents that are used, or uh, is it the fact that the natural ACM is suitable for growing cells, or is it the difficulty of producing it on a large scale?
Uh, the network of natural ECM is susceptible for growing cells
Yeah, it's very
for
suitable
growth
for growing cells. Yeah.
and difficult to produce on large scale.
Okay. So difficult to produce on large scale would be a disadvantage, right? Because if you cannot produce it on a large scale,
Yes, it is, yes.
yeah. So what would be the other advantage? Does the matrix trigger immune response if it's taken from the host himself or herself, or a very closely related species,
Matrix does not trigger.
right? So,
Yes.
yeah, so the matrix does not trigger immune response for a decellularized matrix, and the network of natural ECM is also suitable for growing cells. So, those are the correct options. Okay, so the next question is which of the following is not an objective behind tissue engineering? Not an objective. Two options are correct here. Is it to generate new tissue to replace damaged tissue? Is it to generate tissue in vitro which can be used to regenerate damaged tissue? Is it to embed cells like neutrophils and macrophages in scaffolds to enhance the inflammatory profile of the damaged tissue? Is it to add support or filler material to help the function of tissue? Is it putting scaffolds to help regenerate damaged tissue? Or is it embedding cytokines like interleukin 1 beta or matrix proteinase 13 to create more damage to the tissue? What is not an objective of tissue engineering?
The last one, embedding cytokines like interleukin, will be.
Correct. So that would not be an objective because you're basically damaging the tissue more. What would be the other option?
And another one is embedding cells like neutrophils and macrophages
Correct,
to
correct. So
enhance the inflammatory profile.
yeah, you do not want to do that, right? So in fact, you want to do the opposite of both of these goals. So yeah, okay. So the next question reads: consider that insulin releasing cells are embedded in a scaffold made of collagen. The rate of release from scaffold is given by the equation R2 R squared is equal to 2.2 millimolar per second. The dimensions of the scaffold are as follows. Area is 25 millimeter squared and width is 2 millimeter. In steady state, how much insulin will be released in 5 seconds? Report answer in millimoles. Do we know how to calculate this?
Answer is 11, sir. It is a direct multiplication.
Correct, correct. So essentially, the information that they're giving you here is kind of pointless. The area and the width, because they've already given you the rate of release from the scaffold, which is 2.2 millimoles per second. Now, if 2.2 millimoles is getting released in 1 second, how much will be released in 5 seconds? So that would be 5 into 2.2, which is 11 millimoles in 5 seconds. Okay, so I think we are at the end of week 6 questions. Do you guys have any other questions that you guys might want to ask? Okay, so if not, we can end the session here today. If you guys have, like someone was mentioning, if you guys have any concept that you're not completely 100% confident with, you can bring it up. We'll discuss it in the class. We'll try to make it as simple and understandable as possible. So I'll see you guys next week then. Have a good weekend.
Thank you, sir.
Thank you. Bye.